So I've got 3 minutes to convince you of a number of things. First off, at $2 trillion, clinical variation is the most important thing facing healthcare on the planet, right? Nothing is more important than this. It impacts pharma, it impacts providers, and it impacts payers. It's an $812 billion a year problem in the US alone. Second of all, despite all of that opportunity and the fact that we already know how to solve it, we've never figured out how to solve it at scale. The way to solve it is evidence-based medicine. The way to solve it at scale requires machine intelligence, and we now have that within our grasp. This is a problem that we can solve for healthcare today, and we can get after this now. So why is a problem that's worth $2 trillion a year still out there? Well, ultimately, it's a very hard problem to solve. If you think about any medical procedure, whether it's depression or pneumonia or open heart surgery, it consists of a series of things. Events, every lab, every test, every suture, every stent. It consists of the sequence of those events. So in what order do you do each one of those things? And it consists of the timing of the sequence of those events. And this complex picture overwhelms even the best doctor. Add to that comorbidities, right? Add to that the advancement of medical knowledge. This is enough to challenge anybody, and as a result, we've never solved the problem. We've come up with relatively simple solutions, kind of amorphous national standards of care, but those amorphous national standards of care do terrible on the adherence side because doctors reject them, because they know that that doesn't reflect their patient populations or how they practice medicine. And this isn't simply a machine learning problem. You can't just simply optimize around cost, because every hospital is different. They have different value structures. Just here in the Bay Area, Stanford is different from Kaiser, which is different from Sutter. And so you have to reflect those mission-oriented goals as you try to solve this problem. So how have we done it? So we approach it really from 4 different directions. We use state-of-the-art unsupervised machine learning, right? We've been named Fast Company's one of the most innovative companies in the world twice. The technology that underpins what we're doing is widely deployed across a number of industries, including financial services and healthcare. So what we do is we use that to surface the best outcomes possible for any surgical procedure and present those to doctors. We use their own data, right? So we automatically lower the barrier to adoption. We allow them to dig deeply into that data. So we allow them to understand exactly what's going on with the machine's recommendations, and we provide the best framework possible for solving this problem from adherence and from a tracking perspective. Clinical variation management stands at the center of a whole host of problems in healthcare, from population service to precision medicine. It's worth $2 trillion. We're Ayasdi. We've solved this problem. We invite you to join us in this journey.